It all happened in 1979 when my friend Eleanor, who was president of the new auxiliary, asked me to come to the chrysanthemum ball for the hospital. And that was the beginning. I joined the auxiliary. I became a treasurer, later on the president. My dad had emphysema. He lived about 8 minutes from the hospital. He would call and say, "I can't breathe." I would call the hospital and say, "We're coming." At that time, the emergency room was part of the boardroom. Somebody would come out with a gurney, get my father on it, and within about 10 to 15 minutes, Dad would turn from gray to pink. And then he would be in the hospital probably 7 to 10 days. I, at that point, realized this hospital needs our help. We must build it, because when people call 911, this is where they are going to come. And that's how I really began in earnest to try to help the hospital. St. John's takes care of everyone, anyone. And I think a good example of that is Hurricane Sandy. I had 2 friends who actually swam across the road in order to get into our hospital. We had people who didn't have any place to go living in the lobby. We had healthcare workers who never left the hospital. For 10 days, they took care of all the patients. They were selfless. They never thought about what was happening to their homes. The bottom line has always been important. If we can't afford to run the hospital, we can't help the people. So that has been a concern all along, and really it depends upon everybody helping our hospital, from the community members to the state to the federal government, because we take care of anybody and everybody. We do not turn anyone away. And of course, that's one reason why I care so much about the hospital. That was a very humbling experience. And as I thought about it, I realized that whatever name goes on that facility, it represents every single person who was on the auxiliary and the development board. It represents all of us who worked so hard throughout the years. Women work very hard, in my opinion. They have a job, they have a family, mother, father, relatives. They might have a husband, children, and all of them work to help each one of the member of that family. And they don't think about themselves. So how wonderful to have a women's health care facility nearby that we can educate these women how to take care of themselves. So I'm thrilled that it's going to be there.